We are live.
Oh, okay. You just come off the I-4 and
And there you go. And everybody, I'm going to turn this light off so you can see it a little bit better.
I don't know.
Okay, let's do it.
I don't. There's a Taco Bell.
All right, we are ready, everybody.
All right. Hi, everyone.
Hi.
Hi. So I am Dr. Sarina Barbara. I go by Dr. Vivo. And I'm talking to you guys about geriatric pet care. Some of my favorite patients are the old timers.
Oh, sorry.
Thanks. All right, so this is just a picture to show you a little bit about my pack. So I have Fozzie, who's 16, and then Gracie, who's 14, who's roaming around the building and will be begging you for food throughout this lecture. And then there's just a picture of a friend gathering of geriatric old crew dogs in the picture. So this is just to show you that I not only have experience and love treating my senior patients, but I also know exactly a lot of the things that you guys are going through as owners of these older dogs. So I want to start off by talking about things we can do while our pets are still young so that we can prepare them for a good, healthy seniorhood.
Sorry, I'm trying to see how it looks on line.
You're good. I can press
You
the
can lean
arrow.
forward for a second.
Yeah, I can do that. Hey, Grace.
I'm done with
Hi. I know, isn't she doing great? She's my girl. If we have time at the end, I'll tell you the story of Grace. But okay, so nutrition is a big part of kind of nourishing our animals and creating them to kind of be what they eat. So we recommend here at FloridaWild to feed home cooked. If home cooked can be pretty high maintenance though. So if that's a bit much, we recommend Rick's Dog Deli, which is pretty much frozen portions of home cooked meals. Stella and Chewy's is a freeze-dried option. And then if kibble is just something that we need to feed, then From is a good quality option. So the reason why we try to stray away from our dry kibble foods is because it goes through so much processing. And there's a lot of preservatives. And with that processing, the nutrients aren't nearly as bioavailable for our patients. So on the label, these are balanced nutrition for our pets, but really these nutrients are poor quality and not being absorbed by our pets. The other thing is vaccines. So when we get our cute little puppy or kitten, I think it's very important that we vaccinate them to protect them from potentially deadly infectious diseases. But where we tend to sometimes go wrong is boostering them every year for 10 years, 16 years. That's a bit overkill. Now we're asking that immune system to be challenged to ridiculous amounts, and we can sometimes lead to cancers developing, autoimmune conditions, chronic allergies, chronic inflammatory diseases. So vaccines definitely are not bad. They are definitely required and necessary. But let's try to avoid overdoing it. And we do that by checking titers. So when your pet comes up due for a vaccine, we'll draw their blood, send it off to the lab, and we'll check the amount of antibodies that their immune system is creating toward that particular infection, for example, parvovirus. And if their body is creating enough antibodies to be protected, then there's no need to booster them. So that's our way to know for sure that the animal's protected while not unnecessarily over-vaccinating them. Okay, so annual and even biannual wellness visits. So starting off from the beginning, bringing your pet in every year to do routine blood work and a full physical exam is ideal. So the blood work, it's awesome when we see that the blood work looks perfect, and we still check it every single year because we can compare these blood work from previous years. So just because our cat's renal values, the kidney values, are within normal limits, if we compare it to the year before and the year prior, we can see that perhaps there's a trend going up there, and that we should address potential renal disease developing within the next couple of years and prevent that disease from developing, because disease is much easier to prevent than treat. Lumps and bumps is another thing that we like to check up on our annual visits. Miss Gracie here just had a mass removed today from her left ear. Yep, you can see her little spot there because she had a new lesion just pop up and grow within the last 2 weeks, and it grew pretty fast. So we needed to get on that, remove it, and send it off to the lab, see what it is, make sure it's just a benign kind of sebaceous thing, and move on if it is. If it turns out to be cancerous, then that's a whole other topic we can go down. And I also really like to ask owners when I'm doing my exam if they ever notice any new lumps or bumps, just because owners can amaze me sometimes about the little lumps they find that I really wouldn't find on a physical exam. Like, it's amazing, and then they point it out to me, and I'm like, all right, yeah, that's a thing. I had a cat owner do that a few months ago, and we ended up removing it, and it turned out to be a masso tumor. Tiny little lump that it's amazing that he even found it and brought it to our attention. So putting your hands on your pets all the time and noticing any changes and bringing it to our attention can be very helpful. Heart murmurs is another big one. So we might hear a really quiet heart murmur at their annual visit, and we'll say, okay, let's keep an eye or an ear on it, and then come back in 6 months for a biannual wellness exam. And at that point, it's increased an entire grade. At that point, if we're noticing these murmurs are getting louder, we might say, okay, let's do a cardiac workup and look into this and make sure that we're not developing or about to develop actual heart disease where we need medications to support the function of the heart. Metabolic analysis. So that's just a much more detailed way for us to interpret our blood work, and I really like it to use in our patients to develop a specific supplement and nutrition plan for that specific patient. So no nutrient and no supplement is just great for every single animal in the whole entire world. So by doing the metabolic analysis, we can see which supplements and which nutrients would be best for that specific patient. I knew that was going to happen.
Oh my goodness.
This is the third time it fell out.
All right, so we'll do your own.
Yeah, let's dig it.
How's your heart?
I'm good.
You're kicking?
Crazy. Did it hit you? She's like, nah,
I'm good. Like, whatever, I'm fine. Okay.
So metabolic analysis, is that like looking at the proteins and stuff that make up the blood, or?
So it's actually a Dr. Holder creation.
Oh,
Yeah.
all right.
Yeah, it's very unique to FloridaWild. So what we do is we run the full blood work, and we compare the values to normal intervals. So what kind of Western medicine considers normal. So there's quite big of a range there on what's considered normal. And if everything falls within normal limits, then we know, okay, there's no disease process going on right now. Whereas Dr. Holder spent a lot of time, years and time, into creating a metabolic analysis where we look at the ideal value that these markers should be at. So therefore, we can say, okay, this value is a little bit high normal, and therefore this could mean that this animal is chronically dehydrated and shouldn't be on a dry kibble diet and needs more whole foods with more moisture in it. Or maybe the thyroid level is low, but it's not technically low, but it's not at the ideal. So therefore the thyroid needs some nutritional support, some glandular support in the form of supplements. So that's pretty much how the metabolic analysis works. I'm sure Holder could go into much more detail about it. Yeah, and she'd be happy to. So, oral exam. This is a huge one too. We'll go into more detail about it, but picking up the beginnings of dental disease and addressing it then, rather than waiting 5 years for their mouths to be rotting out, is ideal to jump on it and address some tartar buildup before it becomes full-out periodontal disease. And then joint pain and range of motion. Our older guys start to get a little stiff, and it's gradual, and sometimes we don't really notice. And then in the exam, I'll sometimes say, the muscles on their back look a bit atrophied, or their hind legs, do they seem like they have hip pain? And then the owners will be like, oh yeah, they've been a little reluctant now I think about it to get up and go play. So we can just simply add in a joint support supplement at that point. Yeah, okay, next one. Right, so on that note, Dr. Mason next door runs veterinary rehabilitation. So sending our osteoarthritis older dogs to her for rehab is a great thing. So you can do treadmill therapy, she does massage, Dr. John does chiropractic over there, and she can just teach you land exercises, so exercises you do at home just to keep that range of motion going. Yeah, and it can really make a huge difference, because once they start hurting, they kind of favor and try not to use certain body parts, and then their muscles atrophy, and then they become weaker, and it's just a vicious cycle. So this can help build up their strength. Good girl, Grace. So this is something that we have to offer here, digital thermal imaging. Dr. Baker did a lovely presentation on this a couple months ago, I want to say now. So this is just a very brief summary of what it can do. So it's sometimes not a bad idea to use this in a routine visit. And what it is it picks up a thermal gradient. So it's like an iPad that we go to take a picture of the animal, and it tells us the thermal gradient on their body. So for example, this is just a case where this is an older lab that came in for a routine visit. No complaints, everything well. So to orient you, this is the head facing this way, this is the butt, and we're looking straight down at the back. Okay, so with the digital thermal imaging, it picks up that the red and white area is hyperthermic. It's very hot, a lot of inflammation on that area. That's in like the mid-thoracic area right there. So you go take x-rays, and it shows that there's severe arthritis of the thoracic spine there. So these should just be nice black discs in between the vertebra, and you can see that it's being fused with arthritis on the vertebra there. And that can be quite painful. It is, because there's so much inflammation there. So we can start this dog on some anti-inflammatories. Doesn't necessarily have to be drugs. We have plenty of other anti-inflammatory options. And joint support. supplements, start them on Rehab, and we can kind of strengthen them up and address this pain that we didn't even realize the dog was experiencing. All right, supplements. So this is just an example. We use standard process a bit here of just certain types of supplements. So for example, I like to use Feline Immune Support. That's probably one of my favorite. Our older cats tend to become a little bit immunodeficient. Their immune system becomes suppressed. So just putting them on this supplement can really help boost them and get them through basic, just simple pathogens or upper respiratory infections that a normal healthy cat wouldn't even blink an eye at. And then the Glycoflex, this is just one example of a joint support supplement. So glucosamine is the main big ingredient there. Glucosamine can really help make those joints more slippery and not have so much friction when they move, and it can really make a difference in their comfort level for our arthritic older pets.
Does that help with like spinal disc type stuff too, or is it mostly joints?
Yeah, so it can. So the spine and that's a joint as well. So yep, I'll absolutely give that to my spinal arthritic patients as well. Yeah. Okay, so this one's one of my most favorite supplements, whatever you want to call it, that I love to give my older patients. So it's CBD oil. It is hemp extract. So it's derived from the hemp plant. There's no THC in it. THC is from the marijuana plant, which is the hallucinogenic. There's none of that in that. It's the CBD component. And there's been so much research happening on this product. And it's been found that all mammals have an endocannabinoid system. So we all have receptors, humans, dogs, cats. We have receptors and we have our own endogenous cannabinoids that we create. And these receptors light up or become functional in areas where there's a need of homeostasis, and then we'll bind to it and we'll find homeostasis. So by supplementing CBD, we're allowing the body much more chance to balance and reach homeostasis. And there's been so much research showing the effects it has to improve appetite, help with pain, help with sleep, improve immune function, anti-inflammatory. It's a neuroprotectant, so any of my seizure or my neurologic deficit patients, I love to put this on. Anxiety, cardiovascular functions, so like cardiac patients, I love to put it on. And there's been a lot of anti-cancer stuff out there now as well, so I pretty much put most of my cancer patients on this now as well. And it can make such a big difference. So, and it can really help synergistically with the other supplements that we use, help them work optimally. So the only thing I want to mention really briefly about this is just be really careful of the source that you get this from. You can get CBD anywhere nowadays. That it's pretty much everywhere you look. And I have a whole list of criteria that I wrote up for what you need to look out for if you're looking into purchasing it. So I'm not going to go into it because it's super boring, like the scientific extraction methods. But the stuff we carry here is medical grade. Again, Dr. Holder put a lot of time into making sure that this is a good product. So I do prefer to use the stuff we have here. But if you were to want to seek out another source, shoot me an email and I'll send you those guidelines, because I would hate for you to get a bad source and get some toxins in there, or just very low quality CBD. Okay, back to the dental care. So this is what we want to avoid. And it's actually kind of easy for this to happen when we have busy lives, and before you know it, 3-5 years go by and owners tend to not lift up the lip of their dog. You might notice a foul odor from this dog. So bad breath is usually a common complaint, and then we lift it up and see that these teeth are just rotting out of this dog's mouth. So dental disease is pretty much a source of chronic inflammation and chronic infection that these animals are dealing with every day, 24/7, as long as these teeth are in their mouth. So this puts wear and tear on the kidneys, having to process out all those toxins and that bacteria. Heart disease, those toxins can lodge in the vessels in the heart. Pain and discomfort. If you've ever had a toothache, you know that dental disease is not comfortable. Immune suppression, the immune system's being asked to work on overload 24/7. And then lethargy, the body gets burnt down, gets torn down. And overall, it's been shown to decrease lifespan. So I am a big supporter of getting these teeth fixed up before it gets to this point. And even if I do get a senior patient that has a mouth like this, it's very rare that I say they're too old. Let's just, it is what it is. Sometimes we are at the point where there's too many other things going on and anesthesia just isn't an option. But it's very often that we find that anesthesia actually is an option, and that going in there and getting rid of these teeth is going to significantly improve their quality of life and maybe even prolong it a bit. Yeah, so this is just a little summary showing you what those teeth are supposed to look like, and the dental services that we have to offer here. So I don't know if any of you guys have met Kevin, but he is our main dental guy. He's the one that will talk to you at discharge after we do the whole procedure, and he does a wonderful job at taking pictures and showing you exactly the work that we're doing, so that you can see kind of how severe the disease is or why we needed to do what we needed to do. We're not just in there pulling out teeth for fun. All right, exercise. So I find that some people kind of use their dog's age as an excuse to not get them out as much anymore. And sure, they might not be able to do that 3-mile walk around the neighborhood anymore, but it's still important to get them out and moving, if not just for them physically, but emotionally. They would definitely want to still feel like a dog and still do dog things. They just might need to do it at a fraction of what they used to do. Okay, I'm going to just run through some of the common conditions we see in our older animals. So cancer is a huge one. Dr. Holder not only does 1 but 2 lectures on cancer. It's a whole huge topic that go to her lectures if you want to know all the details on it. But unfortunately, we do see it mostly in our older pets. Arthritis, we talked about that. Impaired vision, I'll get into that. Chronic kidney disease is very commonly seen in our older cats. Cognitive dysfunction is something I definitely am going to talk more about. Obesity, so where's Grace? I'm a little bit guilty of this one. So Gracie's carrying a few extra pounds, but that's not ideal for her health. And I can understand when owners say, but I don't feed her that much, and we exercise sometimes, but she's still carrying a little extra weight. So I get it. It's sometimes hard to get them slender where they need to be, but for the most part, carrying a lot of excess weight with their old arthritic joints and their weak muscles, it it bogs them down a bit more. So, and there's been plenty of studies also showing that lean dogs live longer than overweight dogs. Thank you for showing yourself. I'm sorry to throw you out there, Gracie.
Look at her, she's like, what?
Yeah. Okay, hypothyroidism in dogs. So that's going to be the typical that is typically actually looking for heat. So likes to bathe in the sun. That's all they want to do. Just lay around. It might not just be because that's who they are. It could be that he actually has a metabolic condition and his thyroid isn't functioning optimally. And then cats suffer from the opposite condition, hyperthyroidism. So that's going to be a skinny cat that eats everything, might vomit a couple times a week, and is active and older, but acting and jumping around and seeming like it, acting like a lot younger than they should. So sure, that can be great that they got all this energy, but hyperthyroidism can lead to pretty fatal heart conditions. So we definitely want to address that and get that thyroid settled down a bit if that's what's going on with your kitty. And then adrenal fatigue we'll touch on as well. Okay, so vision impairment is a big complaint that comes up with our older dogs. I feel like a bit more than cats. So these are just the most common reasons why we'll have a dog that's starting to have trouble seeing. So cataracts, this is either inherited or it's secondary to some other disease process happening like diabetes. That's going to be the white eyes. So the lens becomes completely opaque and no light can get through. Sudden acquired retinal degeneration. This one can be scary because they go blind quite fast. Within a couple days, they're fully visual and then they're not. And there's really no true reason why this happens. There's theories, but I don't think anyone's ever really figured out that this is exactly why this condition happens, unfortunately. Progressive retinal atrophy, so that's when you're going to notice that your dog's doing fine in the daytime, and then when the sun sets, they start walking into stuff a little bit and can't really see who that is in the distance, so we call it night blindness. And then nuclear sclerosis is the most common thing we're going to see, so that's just age-related thickening of the lens. Humans get it as well. So as you get older, the lens becomes a little thicker and a little bit more opaque, and it just impairs the vision. This doesn't lead to blindness, it just leads to mild vision impairment, but you will see the little bit of cloudiness in the eyes from this. Okay, cognitive dysfunction is a huge one when it comes to our older patients. So this is pretty much doggy dementia. So the brain shrinks and they develop some pretty rough mental conditions, which can be pretty hard on the family and the owners to watch your pet go through this. So for example, some of the symptoms, so spatial disorientation. So this is going to be wandering. So they'll just like walk circles through the living room and stop and stare at the corner and then walk some more circles again. And you're just like, why? There's just no purpose or intention to it. Altered memory. Suddenly they forget that they're house trained and they start having accidents where it's been years since they were a puppy that they've had accidents, and now all of a sudden they're having accidents in the house. Alterations in activity, so increased purposeless or repetitive activity. So going outside, asking to go outside, you let them out, they walk out, they stare a little bit, then they ask to be let back in, and then 5 minutes later they want to go back outside. And they just repeat it over and over again. And then altered social relationships. So sometimes they react different to family members. Like kid comes home from college that they normally adore, and they're just like, hey. And you're like, that's strange. Why aren't you normally bouncing off the walls when you see them? And then altered sleep-wake cycle. So these guys will, a lot of the times, not sleep at night. They'll sleep all day, and then they'll pace, bark, whine, and wander all night. Cognitive dysfunction is exhausting, physically and emotionally. It's heartbreaking, and I feel for you every time I have an owner come in and tell me this is what they're experiencing, because I've gone through this so many times with my own pets, and I know it is exhausting and it's heartbreaking. So a lot of the times these guys will still eat, and they still have their bodily functions, and it makes it so difficult to wonder if it's time to potentially euthanize at this point, even though they're physically okay, but they're just emotionally and mentally not, and their quality of life is very compromised. So I have, yeah, you can go on to the next one. So I have some options that we can try to manage these symptoms. So I like to address diet a lot. So I like to put medium chain fatty acids that can really help feed the brain. So coconut oil is an excellent example of that. Omega-3 fatty acids, fish oil, CBD oil is great as well. SAMe is like a natural antidepressant. I like to use melatonin at night to help these guys sleep through the night. And exercise. It's important to keep them mentally stimulated. Get them out during the day. Keep them thinking, so that way at the end of the day they're tired and they sleep at night. If we try all of this and we're still having issues, at this point I'll sometimes reach to actual antidepressant and anxiety medications that we can try. Hi Grace.
Hello.
Adrenal fatigue is very commonly seen as well on routine blood work. It's recognized with a low alphos level. This is seen very commonly, and pretty much it just means that the adrenal glands are responsible for responding to stress. So that can be emotional or physical stress. And sometimes when they're asked to respond to stress for years and years, they get tired. So when we see a low alphos, that means the adrenals are tired. So we'll just simply put them on an adrenal support supplement for 6 months. Then we'll recheck and see if they have normalized. A lot of the times they do. Sometimes I find that they need a year of supplement of support. I think I have one that I just decided you just need to be on it for your entire life because they're just such an anxious animal. But sometimes, I think it was like a Pomeranian. And sometimes we'll tweak the dose too. If they come back in 6 months and it's still low, we can sometimes double up on the dose or add in an additional adrenal supplement. Okay, so here's some of the things that we have to offer here that can be pretty unique. So high dose intravenous vitamin C. This is a very nice, potent anti-inflammatory. We pretty much put vitamin C straight into their veins. We can use this in our cancer patients and our chronic inflamed patients. And it's a nice drug-free way of addressing some of these pro-inflammatory conditions. Platelet-rich plasma is when we take the blood from the patient, we spin it down, we get their plasma with their platelets in there, and then we inject it in the site that it is inflamed. I use this mostly with pancreatitis. So we will use the ultrasound, we'll get a thin little needle and just inject it in the belly at the pancreas. And we've seen really nice results with this, with improving their pancreatitis symptoms. Dr. Holder, Dr. Hathaway, and Dr. Schrager are all three Chinese medicine certified, so they do acupuncture and herbs a lot, so I have that to offer. And microbiome replacement therapy is pretty much taking good healthy poop from another dog and putting it in the other one, the one that needs it. So this doesn't actually necessarily have to be dogs. We can do this with pretty much any of our mammals. Yeah, we've even done it with ferrets, cats as well. We do it a lot with. And pretty much what we're doing is we're introducing a potent population of good, healthy bacteria back into that colon. Okay, Sauna Wave is something else we have here. And pretty much what it is, it's like a plate that looks a lot like a computer mouse pad. And it transmits high frequency waves to the location. And it pretty much creates like a local fever when we're using it in our cancer cases. So we'll put it over a tumor. And the idea is that it creates a local fever, and it kind of makes those proteins on those cancer cells denature and become less recognized. It's unable to protect those cancer cells anymore. So then the immune system can come in and clean up and start attacking those cancer cells. So that's a great way for us to use it, and we use it a lot with cancer, but we also are using it a lot with, again, inflammation. So I like to use this in my gallbladder inflammation cases. A lot of older dogs I'm seeing more and more just have chronic gallbladder inflammation and sludge in their gallbladder, and sometimes even stones. And doing a couple sauna wave sessions just on their belly over the level of the gallbladder can really help decrease that inflammation, get that sludge out, and help that gallbladder kind of reboot. Ozone is another big thing. So this is pretty much, we can draw blood from the patient, run it through the ozone machine, so we're hyper oxygenating it, and then we're giving it back to the patient. So this is just improving the cells in the body, their ability to treat inflammation again. I mean, when it comes down to it, inflammation is the core to any disease. Yeah, and it's been shown to have antibiotic and antiviral, antifungal properties. So we can even ozonate saline and use the saline to flush in ear infections and anal gland infections. Overall, it has really nice anti-pathogenic and anti-inflammatory properties. Okay, so when it comes down to it, sometimes these age just kind of catches up with us, and we do have to kind of sit down and think about quality of life with our older pets. So these are the main things that I like to ask owners about. So the first one is hurt. Are we managing our pain well? Hunger. Are they interested in eating? Do we need to kind of give them some home-cooked meals and give them more variety so that we can entice them? Do they need soft food now that they have no teeth? Hydration. Do we have a chronic kidney disease cat that now needs sub-Q fluids because they just can't stay hydrated with what they're drinking on their own? Hygiene. Are they now kind of having messes when they're sleeping? Are they having accidents in the house? And then happiness. How's their quality of life? How's it going, Grace? How's your quality of life, huh? She's like, I just want to get out of here. It's okay, Mama. We're almost done. I know. I'll give you some turkey after, okay? Good girl. Okay, so do they still do things they enjoy? So do they go for car rides, and are they still loving those? They might not be able to go for a run anymore, but maybe go in a wagon for a little stroll down the street. Swimming is great for them. It takes all the pressure off their joints. So are they still enjoying that? Is that something they would enjoy? Mobility. Are they able to get around the house? Traction can be really hard for these, especially bigger, older dogs. So do we need to put rugs everywhere so that they're able to get up and get around? Do we need to put ramps, use ramps to help them get in and out of the car now? Harnesses to give them more physical support. And then also think about, are we having more good days than bad? Or are the bad starting to outweigh our good days? So when it comes down to it, something is gonna give. So we can support these guys as much as we can, give them every opportunity to live forever, but unfortunately life doesn't work that way. So these are just a handful of many examples of my personal senior pets that just life got to them. So Chica, my Chihuahua, her heart failed, had her own heart meds, did all the things, but eventually we can't keep them going forever. Her heart just couldn't keep up anymore. And then Hank, the bigger guy, my German Shepherd mix, he had a bad case of just physical failure where he just physically couldn't move anymore just because of his severe arthritis and his hip dysplasia. He just physically, his body just couldn't anymore. So when it comes down to that, we go to the next one. We do have to unfortunately be faced with the choice of euthanasia. So most of us are going to have to be confronted with this choice at some point. I'm sure all of you have already had to deal with this. And I hear all the time owners say, I just hope they go to sleep one night and just don't wake up. And yes, that's a beautiful thing when that does happen, when they just pass in their sleep, but it's not very common. Unfortunately, life is cruel and makes us have to make this very hard decision for them. So the thing about this is it's honestly one of my favorite parts of being a veterinarian is euthanasia, because I have this tool, I have this ability to let these animals go with dignity and peacefully and surrounded by loved ones, and I can literally free them from suffering. And it's always such a beautiful, peaceful experience, and it's just so nice to just see them take that last breath, and and they're just free. I'm always sad for the owners, but it's very rare that I'm sad for the patients, because they are truly okay at that point. It's just the ones they left behind that it sucks for. But just know that this is an option that we are happy to help you with and make that decision with. We have something called a quality of life score. So if any of you ever feel like you want to just fill out a questionnaire and add up your points and just assess and see where you're at with your pet, feel free to email any one of your doctors here. We'll be happy to email that over to you and answer any questions you have about that. Okay, so conclusion: prevent disease while they're young. Age is not a disease, for sure. These old timers can still have a fabulous, wonderful, amazing life. Yearly screening, so checking the heart, blood work, so we can catch things early before they become a disease or become an issue. And then we offer support as they do get older and they need us to help them out a little here and there. Okay, so if you have any questions, you can email me there. This is just a cute picture of Buddy, one of the patients here. He's the man and he has hilarious ears, so I figured I'd put him up there. Does anyone,
Is there a handout?
as far as this PowerPoint?
We can email it to you.
Yeah, so we can
yeah,
give it to you
that'd be good.
electronically.
Oh,
Yeah.
okay.
Absolutely, you can just,
And what was you called it the something score?
quality of life
Quality
score.
of life score.
Yep. We can absolutely give you that as well. And then I also have the CBD guidelines as well, criteria that,
Can you put that Dr. Martha?
oh yeah, can you see it?
It's Dr. Barbara
So,
.FloridaWild @gmail.com.
where'd Grace go? She's like, I'm out of
She
here.
gave up on
Circling the ham trick, this is a turkey trick.
She deserves it.
Did you see that
She's a
one
good
time, Dr. Barbara?
Yep, so it's Dr. Barbara, just like her first name, Barbara.